Welcome, everyone. My name is Stephanie Aguilar with the Association of American Medical Colleges. I just wanted to let you know that we will be recording this webinar today. And now I will pass it over to Dr. Deborah Pohl.
Thank you, Stephanie. Thank you all for coming out tonight. We in the ORR and the ORR Connect group are so excited to present this time-relevant lecture, Navigating Contracts in Academic Medicine, with Dr. St. Onge. Dr. Joan St. Onge is from the University of Miami Miller School of Medicine and is a professor of clinical medicine and the Senior Associate Dean for Graduate Medical Education and Faculty Affairs. She is also the AMC's Group on Resident Affairs, the GRA Steering Committee Chair. We hope that this session will be interactive and welcome a discussion in the Q&A session that we'll moderate throughout the last half hour of this session. Dr. Michelle Perkins and Dr. Ihama and Jakub will also be keeping an eye out in the Q&A. We'll also look at the chat, but would prefer that you guys post the Q&A for any questions that you guys have for the second half. With that, I'll hand it over to Dr. St. Onge.
Thank you very much, Deborah. And I'm really very pleased to present this presentation tonight. I hope that over the course of the next half hour, some of your burning questions about the contract process and your kind of next step in your career will be answered. And I look forward to continued conversation about this after the presentation. I'm going to actually bring this presentation up and get started. This is from the beginning. So I hope everybody can see my slides. But really, I wanted to call this Negotiating the Next Step in Your Career, because many of us are on different paths, whether it be at the end of your fellowship, the end of your residency, whatever it is. You might be mid-residency and really thinking about what I need to do to get to the next step. I want to also acknowledge the fact that this is a topic that we presented as a group. David Kuntz, Melissa Palma, Dr. Witt, and myself presented at the GRA and ORR meeting in May. And so some of this presentation came out of discussions about what residents really wanted to hear about. So I want to make sure that we focus on that and acknowledge these individuals as well. So for the next half hour, we're going to really talk about the process of faculty hiring and academic appointments at the AAMC member institutions, academic medicine being really a focus of this talk. But we're also going to talk a little bit about other opportunities. And when you are looking at jobs and looking and interested in academics, it's not only at the medical schools and their associated institutions, but there's a lot of other opportunities. And then really what you should be doing to prepare for employment after your residency or fellowship. I did receive a number of questions from the ORR, and I wanted to just acknowledge the fact that we are going to be focusing on, and hopefully I will be answering some of those questions. They relate to salary and benefits, negotiations, when and for what you should be negotiating. What would your job responsibilities be as a junior faculty member? And really talking about, and we'll start with, what an academic medical center is versus a physician group practice that works within the medical center. What are the different types of situations and employment agreements you can be looking at this time? So to start with that very first question, I just want to make sure that I acknowledge that there are a number of different types of organizational structures that you will encounter as you look for your next position. There is a university-owned practice plan where you are employed by a university as a full-time faculty. You see a person like me. I'm the Senior Associate Dean for Faculty Affairs. You will have a full-time faculty appointment, and in this situation, you may be governed by different rules than, let's say, a staff physician within the same organization. at University of Miami and the U Health system, we actually have both full-time faculty who have an academic, research, or teaching responsibility in addition to clinical care. And then we have individuals who come on as staff physicians who do a little bit of teaching potentially, but they are primarily hired to do a majority of their work in the clinic. So it is a very different organization. We have also, you may see that there is a health system model that employs you as a physician, and they're affiliated with the medical school. So I will bring up my own experience, let's say the Jackson Health System, which is right across the street from University of Miami, Miller School of Medicine, but it does employ physicians in addition to working with us who are employed by the university. So we, the individuals, let's say in emergency medicine, which is one of the departments that really has its own function at Jackson Health System as one of the #1 trauma hospitals in the country, they employ those physicians, but there is a very, very important affiliation with our medical school, and they teach all of the residents and all of the students from the Miller School of Medicine. So the hospital actually affiliates with the medical school. And then there are those institutions that may not have an organization like a big hospital that they have to employ the physicians. So let's say you're at a university that has a school of medicine, but their primary teaching site is another health system. So the university employs the faculty, the university contracts with the health system for the physician services. And although your paycheck and everything comes through the university, your work is actually done in the health system. There is an agreement between that health system and the university. So there's a lot of different ways that you can engage in academic activity. Full-time faculty, the traditional model, a health system like a Jackson Health System and the emergency medicine folks who work for Jackson but have an academic role, or let's say a college of medicine that doesn't have a huge clinical enterprise that affiliates with another clinical enterprise, and they contract your services. So you can see all of the above. And actually, if you look at South Florida as one example, there is all of the above in opportunities for different individuals. So when it comes to really looking and searching for a position, timing is important. Budget cycles usually start, and I have to say earlier and earlier, but January through March, departments are looking at their budgets. They're looking at forecasting for the next year. They're trying to figure out exactly, okay, do I need another physician in this area, in that area? They know people may be leaving. There's a certain amount of attrition. The academic year usually starts July 1st. So somewhere in that sweet spot between now, let's say in January, you may want to let people know and reach out to them through the various means to say, I'm interested in working for your organization. Here I am, here's my CV, etc. Even though the academic year starts usually in July for us in academic medicine, a lot of residents and fellows coming out of their terminal year or their last year want to study for the boards. They don't necessarily want to start until September. And that usually is kind of a typical time cadence. They can start earlier if they would like to, but a lot of times between moving and getting that board prep under your belt, people are very, very happy to start in September. But again, that may vary. In terms of what you should be looking at and sources that you should be using for searching for a position, there's a lot of different ways to go about it. And this is actually continuing to expand in our society. So there's the typical physician services groups, quote unquote, the headhunters that you look for, organizations, big universities, medical centers will contract with them to search for specific physician to be employed by them. I want to put a shout out to the AAMC Career Connect for academic medical positions. There's a lot of very good information there. If you are in a specialty society, I wholly 100% encourage you to look on their website. The ACGME has also Career Connect. Cold calling or just dropping an email to various individuals within an organization that you may be interested in working for does work. And sending an email to the division chief, the department chair saying, I'm finishing my residency or fellowship. I'm very interested in your organization. Writing a cover letter, sending a CV is another way to go about doing it. Some of the websites that actually were not really that popular a few years ago are becoming very, very popular. Indeed, Glassdoor, those are some of the places where you may see jobs posted, and you may want to look at that site as well. Social media, LinkedIn and Twitter, again, in addition to those other sites, are very, very important. LinkedIn and Twitter has become one of those, kind of, I hate to say it, I'm dating myself, but there are a lot of people my age and maybe a little bit younger using Twitter, but they're also posting for positions in their organizations. People I see, medical students and residents, kind of getting out there and showing what they're doing in terms of their research, et cetera. So it's a good way to get noticed, but it's also a good way to keep an eye on things within certain affinity groups who may be posting for positions as well. And then networking within your own institution. You should be letting your division chief, your program director know that you are interested not only potentially in working there, but where you want to work. So really finding out who they know, how they can help you contact the individuals, either through, again, your specialty societies, but through the program director, organizations, et cetera. So these are just some of the ways that I would encourage you to think about using. The first, in terms of the physician recruitment groups, a lot of times they are employed by those specific organizations who are looking. So just keeping an eye if they have websites, et cetera, they may be posting information out there as well. In terms of considerations, what you want to think about now, if you are not a resident ready to go out into the next step in your career, many institutions are looking for an early commitment. And this is actually something that, let's say you're working for the University of Miami Jackson Health System, and they have a huge amount of new sites opening up within the next few years. They are looking for individuals who they have trained, who say, yeah, I want to stay here and I would like to sign an early commitment. And a lot of times with that comes a stipend that will last throughout the rest of the residency. So individual departments or universities, health systems are looking at this to say, we are training all of these great individuals. We would like to retain them for our future growth. And you should make sure that you know about these recruitment packages, because it may be at your own institution, or there may be other institutions that you are interested in, whether it be by location or just reputation, that you may want to contact as well. The other consideration is, and I'm coming from the state of Florida, so I know licensure in the state takes time. Start early. If you have an idea of where you would like to be in terms of a state, you want to look at what their licensure requirements are, how long it takes, and you may want to start that process early so that you are already halfway there by the time you start thinking about actually signing a contract or really talking seriously about a job. In terms of contracts in academic medical centers, we use kind of the cart analogy: clinical, administrative, research, and teaching. Those are kind of the different categories that you may be fulfilling and working within in a new job in an academic medical center. A lot of the work early on for many people coming out is a large percent of time devoted to clinical work, but there may be an administrative piece. You may be very involved in research. So that also can take up a good percentage of your effort. But also there's an expectation as academicians that we're all engaged in teaching. How that really comes across on your offer letter is important for you to know. So let's go into each one of these different areas just to identify and expand a little bit on what you should be looking at. So for the clinical, this is for academic-based practices and community-based practices. You will always have somewhere in your offer letter some type of productivity target. It may not be for the first year or the second year, but you should be aware of those and you should be looking at them carefully. Work RVUs are basically a metric for productivity. It reflects a payment for the episodes of care that factors in complicated care by specialty. They're benchmarked. Usually they're just not made up, like you can do 1,000 RVUs, et cetera. They're usually benchmarked to external sources. You can get those sources and get an understanding of what they are. They should be very obvious in terms of your offer letter that this is how they benchmark the RVU. And it's tied to your salary and percent effort. So let's say a surgeon would have an expectation if they work 100% clinically, which is very unusual in academics, to have, I'm going to make it up, 1,000 RVUs, but you're only going to be working 70%. So you should only have an expectation of 700 RVUs. Usually in the first year to second year, there's a ramp up period and you will be kind of protected. Your salary will be protected, and you will be expected to continue to build your practice as you get toward that time when there will be an opportunity for bonuses, but also an expectation that you will make that RVU or productivity target. So it's important to look at that, look at the ramp up period, look at what they're going to do for you while you're in that ramp up period to make sure that your name is getting out there, that you're starting to see the patients that you need to see, and that you're building your reputation as well. Education is something that I tell all faculty. The reason why we are faculty is because we're involved in education, teaching in some aspect. So there may be a specific role that you are applying for with a percent effort documented. Many of us say about 10% of our time is working in education. But if there is a specific role, an assistant program director, an assistant clerkship director, a director of the ambulatory clinic, that actually should be documented and there should be designated effort for that. You will most likely be asked to do rotations on a specific clinical service as the attending. That actually is the fun part, I think, of our job in anything, but that should be pretty obvious about what those expectations are going to be. And many times it's just kind of built into the general faculty expectation. But there also are different things that you may want to think about as you go through your residency and fellowship about the types of skills that you have developed. Quality improvement and patient safety. If you are working in that area right now and really learning the tools, that may be something that you want to highlight because that may offer you an opportunity to take a specific educational role. Have you developed curriculum? And is this something that you want to do more of? And then we talked about the different levels of program director roles. Many of those are open and available to individuals who have, let's say, been an administrative chief resident or played a big role in education in their residency program, that there may be an opportunity to step into more of a leadership role. And I started my job at my first job at Georgetown after I was the chief resident as the director of the ambulatory clinic. And I have to say that that really started me on the path. I was working with the residents in the ambulatory clinic, but then, there's other roles that you might have an opportunity to direct either in the clerkship or also on the residency side. So look for those opportunities. Think about your own career and what you've already done and your skills that you bring to the table, because this may be something that you would like to see. Administrative roles, you should have some administrative time for clinical follow-up built into your kind of, we call it a pie. If a pie is 100% FTE, 80% clinical, 10% administrative. This is when you do your follow-ups, your call-ups to patients, your follow-up from the patients that you've seen. And then there's an opportunity, as I mentioned, for a specific administrative role. So that would be on top of that administrative time for follow-up. And research. Many of you have had experience and have opportunities to continue in research that you have started developing. There are different ways to do this. The tenure track versus the non-tenure track is the first question that you want to think about. Tenure track has its ups and downs. One up is that you usually have a package of support for startup that lasts over a number of years. You have a formal mentoring committee. You are expected to, over that course of years, develop your own grants and independence. But you usually have to maintain and get tenure by the time 7 or 8 years comes down from your initial appointment to be tenured. So you have to be very, very productive in that 7 years. The non-tenure track is usually called the clinical educator track. It is when you are one of those kind of triple threats where you have clinical work, you have research, and you are also are teaching. So the question is, what percent of that effort do you want to have as a research person, and how is that going to be funded? In the non-tenure track, you really want to make sure you have, and if you're interested in research, you want to make sure you have specific time, develop your research portfolio. How much time and for how long should be spelled out in your offer letter. And in both of these tracks, and in the clinical educator track, in the research tracks, in the tenure tracks, you want to make sure that there is mentoring, that it not only is down on paper that you will have mentoring, but there is evidence that it exists when you talk to other faculty member, and that they have been effective in terms of the mentoring that is in place for you. In terms of salary, that's always a big question. Like, how do I determine what is a fair salary? Well, you should know the benchmarks. The AAMC has the salary tables, which are total compensation, not just base salary. So that it includes bonuses, it includes a lot of different things, but it's a good place to look at kind of the assistant professor level in the, they go by 25th, 50th, and 75th percentile. But in all of your specialties, you actually have availability to at least look to see in academic medical centers around the country what type of salaries are being offered. It is based upon geography, but also there's a total salary from all the nation that you can look at as well. The MGMA database is available. It's very expensive, I have to say, but this may be something that the organization uses, and so they should make you aware that this is how they determine their salaries. You need to think about cost of living in the geographic area, and I don't think I need to emphasize this any more than in the last year, where we had inflationary pressures. We've had housing prices go through the roof. We've had to adjust our resident salaries, but also our faculty salaries. And you want to know, if that happens, is there a cost of living increase that is built in? How is your salary adjusted? Do you just work on a bonus situation, or is there consideration that there is a tie to the cost of living and there's a cost of living adjustment that will go forward? And then you need to negotiate. And one of the things that I learned this year when I went through the women, there is a program called ELAB for educational leaders in academic medicine. It's a fellowship, but one of the sessions we had was about negotiations. And it turned out for the women on our call that women negotiate 4 times less than men. And I think to myself, yeah, I don't think I'm a very good negotiator. But not only is it true, but when they look over all professional careers of women versus men, at the end of the day, when you're ready to retire, there's about a $2 million difference in terms of overall wealth. So you should not feel uncomfortable about negotiating. You should have a reasonable aspirational target, basically knowing the benchmarks for your salary, knowing what you're worth, something reasonable, and you can talk to your mentors or your individuals who are in the field about what seems to be reasonable. And then you have to also have an idea, not only the aspiration, but what number below which you could not see taking the job, that you just have to decide, you know what, love the place, think I would do well here, but I'm not going to take that job because they're not going to pay me enough money. You have to think about your financial situation. You have to think about the cost of living, but there may be a floor below which you don't want to take the job. However, in most situations, there's room for negotiation, and that I think is really key. You should not be afraid of negotiating. Hopefully the ORR and some of the things that you do in terms of your own education will help you learn to negotiate, practice with a best friend, sit down in front of a mirror and have that conversation. But get some feedback on how you are thinking, so that you can go in and negotiate, and don't be afraid to say how you feel in a professional way, but just say, this is what I need. And this is, for the most part, what I think I'm worth. And most individuals and most organizations will say, okay, that's fine. But unless you say it, you're not going to be able to know how they're going to respond. So negotiations are really, really important. Think about benefits. This is something that when we looked at our own residents at Jackson, and we asked, what are the things that are most important to you? It wasn't necessarily salary, but it was benefits. So thinking about what your health insurance is going to be, how much are you going to have to pay for that health insurance? What are, if it's important to you, what are the child care options, and how much do those cost? Are they even available? Whether there are any help assistance programs for housing, no interest loans, low interest mortgages, university owned housing. These are all individual, depending upon what university or what organization you're looking at, they may have opportunities, and hopefully they'll tell you right up front. But you should go on the website and take a look, and just as you get onto the websites of these organizations, look for housing opportunities and see what comes up. Federal student loan programs, we've talked that that's been in the news a lot. There are student loan programs and other loan forgiveness programs, maybe related to your own institution. A few years ago, we put one in place prior to the pandemic that our goal was to help individuals who are coming out of our residency programs really look at, give them some assistance for loan forgiveness. We have morphed that into that other, now, if you work with us, we're going to give you a stipend through your residency. So we've changed it a little bit. What is the benefit for professional development? How much CME time do you get? How much money do you have for professional development? What's the retirement plan? I will never forget the first day of my career at Georgetown when somebody sat me down and say, what do you want to invest in for your retirement plan? I was like, I have no idea. But you know what? I'm glad that they made me do it from the very first day. It was very worthwhile. Now looking over the many years since that first day at Georgetown, it's important. You need to know what they match. Are there vesting periods? What are those types of, what's that information? And a lot of times this isn't something that's going to be on your offer letter. You're going to have to look at the benefits site. You're going to have to ask specifically about that. And although it seems funny to be asking about retirement before you've even started working, it does add up, and you need to know about this. And then relocation and sign-on bonuses. These are standard. And I have to tell you that this is another area, depending upon the organization, where you're going to want to negotiate for what it's going to cost for you to relocate to a specific organization, or how much you need for a sign-on bonus. Because honestly, you're coming out of residency, you have a lot of expenses. it may be very, very helpful for you to have an extra $10,000 to $20,000 just for signing on to your new job. And many times that has some tail to it in terms of you need to work here for 3 years so that, we'll give you your sign-on bonus, but if you leave after a year, you're going to have to pay some of it back. So those are all of these things that you want to look at your offer letter, make sure it's crystal clear about what these things are. Many organizations have a standard set relocation and sign-on bonus. There's really not that much negotiation, but other organizations, you may be able to negotiate the amount of these bonuses and relocation fees. Okay, that's about your negotiation and offer letters, etc. One of the things that I think we need to think about right away is transitioning for success. You want to be excellent at what you do. You want to hit the ground running and know and gain a reputation that you are really good at what you do. You have, I would say, the beginning of any new job is very, very challenging. I would use the resources that individuals have. I always have told my residents as they go out, work in an organization where if you have a question about something, there are a lot of people you can turn to. If you are dealing with a lot of chronic or complex patients, if you have, in the surgical realm, you want to also make sure that there are individuals who can continue to teach you, because the learning curve when you first start practice is going to be pretty steep, and you want to have that support. Always, always, always ask for help and feel and make sure you're going into an environment where that's kind of the help is available, and there's people who are more senior to you to really make sure that you can continue to progress in your career. Acclimating to a new environment, I cannot tell you, it is challenging regardless of how many times you do it. So you need to give yourself a little bit of leeway. Hopefully we won't be talking about COVID any longer, but those that in and of itself brought up a lot of challenges. Do you want to be closer to home? Do you want to be at a place where you have some support for your family, etc.? And I'm keeping an eye on the time. I'm a few more minutes and we'll be just in terms of the COVID-19 and the rapid changes. Remember the transition to telemedicine. If you know how to work in a telemedicine space, fantastic, and you probably already do. I call it the pluripotent faculty, but those who have been recently in the hospital, if there is another surge, if there is a crisis, you may be asked to do more hospital care or ICU care. This was the first time we had layoffs and furloughs, so you want to make sure that that is very clear when you go in. If some crisis happens, how is that handled? How are you supported through stressful situations? And also thinking about the new areas of specialization and research. I definitely think at the beginning of your career, take advantage of the things that we do not know, because you can become an expert. And then also, I think we all have addressed the changing expectation of work-life balance and what it means. Okay, I will really start and just say, just think about some of the details in your contracts that may have been brought up through the COVID consideration. What's the work-life balance? What type of mental health support is available? Do you have, are there termination clauses in your contract? Usually, if you're a faculty member, the faculty manual pretty much prohibits these types of things, but you want to look very carefully. Disability insurance as well is an important consideration. And then also, somebody asked about, should I have an attorney review my contract? Yes, it's important. You should do it. You should not be shy about it. Contract language is complex. Restrictive covenants, they exist. There are some things that we have a 15-mile radius after for 1 year, you can't work 15 miles from places that you worked. And that actually is very important to say, is it the primary location? Let's say I work in Miami, or is it everywhere that UHealth works, including Naples and and Broward County and Palm Beach County. Usually that's very, very well spelled out, and you should look at that. And what kind of cell phone and computer allowance do you get? And what type of marketing are they going to do for you so that you are successful in your career? And then I will just leave this. There are some things that you want to be aware of. You cannot join a faculty practice if you cannot get licensed. So you need to make sure that you are licensed in the state, that you have done all of the CME prior to the state licensing. That will be aware, you'll be aware of that. And then a lot of times in contracts, they are going to very specifically spell out exactly what the days of the week, the hours per week, et cetera, that you're going to be doing. Some contracts will be like this, and others will be just very generic, like a 20% clinical, 10% research, and 70% education, et cetera. So you want to look at this about how your time is documented. Do you have responsibilities for providing that documentation back to your employer, or is it basically just very broadly defined? And that will depend upon the organization you're going to see. Okay, we talked about termination clauses. You want to look very carefully at those. Non-referral or star clause, you cannot. There's language about the federal statutes around self-referral, et cetera. And then also what your duties, a lot of times they'll give you a job description, and duties and responsibilities are very important, as well as intellectual property language, opportunity for different benefits, et cetera. So you want to have an attorney look over this, and you want to be comfortable with what you're signing on to. Okay, so I think I hit almost all of those questions. I'm going to stop sharing. Will you be at the bottom of the totem pole in your role as early career faculty? I think that anyone who is new into an organization is kind of at the bottom of the totem pole. I came from Washington, D.C. into Miami, and I have to say, I had to earn my credibility. People didn't know who I was. I had to be an excellent physician, but also an excellent educator. So I don't know whether it's related to the fact that you're just a junior faculty or whether you're new in a position. If you stay in your same organization, that's going to be a very different approach as well. So negotiate. I think that it's important. We talked a little bit about negotiation. It is important to know what you can negotiate. A lot of the, I'm going to just stop sharing. A lot of your organizations, if it's a state university system or a public entity, many times they will have a standard contract that there's not a lot of room for negotiation. However, that is, you'll be aware of that right up front. You still should review that contract with an attorney just to make sure that you know exactly what they're asking and what you're signing on to do. But many places have negotiations in all of those different areas. And I am going to stop here. And I know that there's some questions as well as some in the chat. And I think I've gone over a few minutes. I apologize, but I hope that was of help to you in terms of the different aspects that you want to be thinking about as you enter your next step in your career. So thanks.
Thank you so much, Dr. St. Onge. This was really helpful for everyone thinking about prospective job applications. So I can just head things off with one of the questions from the Q&A, and then we can keep going through the Q&A questions until we are at the end of the time. So somebody asked, I think this is relevant since we were talking about having an attorney look over contracts. Do you know of any resources where we can find lawyers to look over our contracts, or do you have tips on how to find someone to help with that?
So I would suggest potentially asking, depending upon if you're staying within your organization, there's probably people who just were junior faculty themselves. You can ask if there are individuals they have used. If you are in a large organization, a lot of times human resources, we do a lot of business of medicine training for our residents, and many times they will have a list of individuals who they have encountered, they have provided or know about. So the organization themselves, where you are right now, can provide you a list of information. It's kind of word of mouth, but it's also, if you know, I would say the human resources groups, the faculty staff assistance programs at your organization usually have a legal arm. You think all the time it's about mental health and about healthcare issues, but many times the faculty staff assistance programs also have, recommendations for legal assistance, et cetera. So you can also look there as well. If you're in the union, CIR usually has a whole list of organizations and individuals they have worked with as well.
Great, thank you. And then another question that is, sort of similar to that one is, what about third-party companies or recruitment agencies as far as finding or negotiating contracts?
So third-party companies usually are working for someone, right? So they are kind of the talent reviewers, right? Many times it's the organization, and they are the healthcare institution. The university has contracted with them to search candidates. I wouldn't necessarily think that they would be the best people to ask about your contract, because they want to make a match, right? Which is a good thing, because they're working in your favor. But in terms of having a third party, I think I would have my own counsel look at them as well, look at that contract.
Awesome. I think the next question is pretty interesting, with the changing of medicine overall, with who is in the field of practicing medicine. So how do we manage like APPs as part of our contract, with supervising them or other responsibilities that might evolve over time?
So one of the things that I think is important to know, what the scope of work and your responsibility is going to be now. And many times when you're starting as a junior faculty member, you may not necessarily be working with an ARNP, but in many of the surgical subspecialties, et cetera, they may be working right along with you, right? So the question is, do they bill separately so you are not involved in their supervision, et cetera, or do they bill what we call incident 2, which is you are their supervisor and they're billing kind of under your license. So that's the two different types of advanced practice provider relationships. So the question is, 1, do you have access to them? 2, what is your responsibility in supervising them? And making sure that that's very clear. And if it's not necessarily open to you as a junior faculty member, as you become busier and busier, you can ask other faculty, do you work with advanced practice providers? How do you work with them? What is the model? And probably with each person that you'll ask, you're going to get a different model, because so many people have different ways of interacting. But I think it's a good sign when they are in the area and working with the physicians, because there is a lot of extension of the work and independent work that they do, which is really going to help in terms of helping you develop your own practice and time to develop your own expertise as well. The other thing is scribes, right? So scribes have become more and more utilized in the clinical arena. And the question is, would you have access to a scribe? And if you do, does your RVU target go up, or do you have the same RVU target because you have less documentation to do and also that also is something that's very new, probably the last 3 to 4 years. They become much more commonplace, but it is something I think if there's one thing that I would like, it's a scribe to help me as I see my patients.
Definitely. And then also speaking about like contracts evolving, what's an appropriate length of a contract, 1 year or 2 years? And is it possible to switch between CART tracks during contract, like when you're signing, or between those time periods?
So one of the, usually when you have an initial contract, as I have seen it, there's usually more than a year of appointment. It's usually 2 to 3 years if it's a non-tenure track. And that during that period, it's pretty well spelled out that you have to maintain your professionalism and you have to, be a good faculty member over those 3 years, but you'll have a guaranteed salary and an RVU target after year 1, year 2, year 3. After that, a lot of institutions go to yearly appointments that you get renewed every year. Some have 2 to 3 year appointments. Others have 3-year appointment that continues to be renewed. So it depends upon the organization. In addition to the CART distribution, I think if you're interested in research and you already have a research pathway that you kind of designated, you want to make sure that you have protected time for research right up front, because that can expand. But if you don't have time to really make it happen for yourself, either whether it be 20%, 30%, whatever, and have that mentorship, it's hard if you have a huge clinical load to then carve out that time to develop your research career. So you can switch among all of those different things. I think, if you talk to some of the more senior people like myself, I've gradually, at one point I was probably 80% clinical, and then I was 50% clinical. And now I'm a lot less clinical and more administrative and more teaching. So it depends upon, and you get opportunities, and those things can change mid-cycle if the opportunity avails you. If you get a grant and you now have part of your salary supported, that can change. Granted, it takes a little bit of, like, you can't cancel my patients tomorrow, but I can, look ahead a few months and say I'm going to be needing more time for that. So yes, that can happen.
Okay, another question. Oh, Michelle, do you want to ask the next question?
Oh, sure. So the next question is with regards to financial aspects of the contract. So do you have any general ballpark numbers as far as what you've typically seen as far as travel allowances for conferences, sign-on bonuses, and relocation costs or moving stipends?
So sign-on bonuses and relocation costs, this is actually where I find the biggest spread of different. We took a look at it, and honestly, it depends upon how far you're moving. Let's say you're moving from California to New York, right? The expenses are going to be much greater, and so you should ask for what you think is reasonable. If there are, I've seen sign-on bonuses of 10,000, I've seen them of 20,000, I've seen them of 30,000. It depends upon the urgency with which they need you, one, but also there may be a very specific reason, because all of a sudden the housing costs have gone up and they realize that, in order to make the move and to have time and to make sure that they supplement your salary in some way to cover those expenses, they want you can negotiate that in most situations. Now, again, in some of the public universities and organizations, that may be very, very standard. If you are going into an organization that has a union for their faculty as well, that will be very clear, because that's usually negotiated as part of the collective bargaining agreement as well. So that's also an aspect that we didn't talk about, but some of these things may be already codified through their practice plan or through negotiations with a larger group.
Could you also speak to how those sign-on bonuses and moving bonuses are dispersed? Are they typically given as a tax bonus once you start? Is there a way to get them beforehand when you're actually doing the moving, things like that?
So what I have, we have, and I have seen it provided upfront once the person, it's unusual to be given it prior to your employment beginning. However, within the first month, you should be getting your relocation. Usually it's you turn your receipts in and you get reimbursed, right? So a lot of times they'll say up to a specific limit, and you can use all of that for relocation, and then you get the money returned in your paycheck. If it's a sign-on bonus, usually that you should negotiate that it's going to come within your first month, with that first paycheck, because you don't want to be waiting for 3 months or 4 months for your sign-on bonus when, that is financially, when you think about it, you've just ended your residency or fellowship, you might have had to take some time to study for the boards. You don't know what type of expenses you have. You're going to start paying your loans back. So there's a lot of different things before that first paycheck comes in that you want to make sure that you have a little extra cash. Some may give it to you sooner, but usually it's with the first paycheck, if not the first, the second. And usually there's some payback related to that if you leave before a certain amount of time. So you should be aware of that.
Okay, great. And then a couple of questions related to salary. So someone asked if the AAMC salary benefits list differences based on career track. So clinician educators versus research versus just clinician. And then someone also asked about regional and, location differences in salary. Is there a way to know what's reasonable for your area?
So yes, there are. And I have to say, in addition to the AAMC salary tables, which again are total compensation, total everything. It's not just your base salary, but it's any bonuses that people have gotten, any administrative supplements, those sign-on bonuses will be included. So they're all reported. And it is something that that can be divided regionally. So Southeast versus the Mid-Atlantic versus the North, West Coast, East Coast. So you can parse it a little bit more by geography as well as by specialty. So they'll go through every specialty in medicine, every specialty in pediatrics, and then go assistant, associate, and professor. They don't necessarily break it down. Let's say if you are doing research versus clinical, but they have the clinical departments, the basic science departments. They have PhDs in the clinical department, so that will be available as well. So you get a good idea of what kind of a pure researcher does. So it is a good benchmark. I know that Eric put in the chat, the Career Connect website, as well as just some of the information that is out there on the AAMC. Definitely use it. Now, other organizations that you might want to think about looking at, these websites like Glassdoor and Indeed, I have to say, I've been amazed at the amount of physician postings there are. So you can actually look across the spectrum of, let's say I'm looking in Fort Lauderdale for an emergency medicine physician. There may be postings there and they'll give you like the average salary of that area. So it is something that is not necessarily vetted 100%, but at the same time, it will give you a little bit more information as well.
Great, thank you.
Mhm.
And then we've got two questions about the specifics of going back and forth with negotiations. So someone asked, if money is really tight and an institution says there's not much room for negotiation, how would you navigate that? And then someone also asked about using competing offers to negotiate. Do you explicitly say what's included in your other offer, or how do you sort of navigate that situation?
So with the one question about we're kind of tight and we can't negotiate, well, that's why I wanted to just put out there, what's your aspiration, what's your reasonable amount of salary, and what's something that you just can't tolerate, right? So I would be very mindful of organizations who use their financial situation as a reason why you shouldn't pay you, $10,000 to $15,000 more or whatever. So I would try to be reasonable and think about what you need, and then ask for it. They can only say, if they say no, they say no. But I think that you want to at least give it a try, because you don't know what they mean by, we're kind of tight and we can't necessarily negotiate a lot. I can tell you that there's probably somebody offering or negotiating for $50,000 more than what you are, down the hall. So it's up to you to really think about what's the 25th percentile, what's the 50th percentile. That's why those AAMC salary or the MGMA salary numbers will be good. And what can you afford to take, right? And you don't want to shortchange the fact that you are all really well trained and that they're investing in, right? So you want to feel good right up front, but you don't want to go for these astronomical salaries that are kind of unrealistic, which is why I think you need to talk to folks too about what you're negotiating for as well. And then the second question was, let's see. Do you want to show them your offer letter from somebody else? I don't know. I think you have to feel it out. You have to decide. I've seen faculty actually bring their offer letters in to say, look, I have this offer, and we try to match it when they are already on our faculty. I think that if you're reasonable, and let's say you have an offer that is really very, very different from the next person, from the offer that you're talking about, you might want to bring it up and say, well, I've been offered $50,000 more. I'm just making it up. And they may say, fine, take the offer, but you have to be ready to have that answer come back if you bring that up. So it is something that it's a little bit of a gamble, but I think if you feel comfortable, then that's something that I can't advise you yes or no. You got to feel out the situation and think, how much really do you want this job? Are you willing to put it in jeopardy? Because depending upon who you're negotiating with, they may take offense to the fact that, you're pointing at people down the street who are giving you more salary. And the question is it a like institution, or is it someplace very different? And that's the other thing. We have a lot of competing organizations within the South Florida area, and some are really, really academic and some are not. So the offer that you get from one organization versus another is going to be very different in terms of the scope of your professional career. And that's something you have to think about as well. And I think in every city and state, there's probably the same types of organizations within in very close proximity. So you need to think about that as well.
Well, thank you so much for speaking with us tonight. We really appreciated all your wisdom and knowledge. I think we've had a lot of good information going into the next contract season for ourselves. So thank you so much for joining us. And thanks everyone for being here tonight. If people have additional questions, I think Stephanie posted in the chat, you can add them to the same Q&A link, and we'll try to compile them and send them out to people. But I'll hand it off to Stephanie just to have our last remarks.
Thank you for joining us this evening. This concludes today's webinar. The session has been recorded and will be available within 3 to 5 business days. If you have any questions, please fill out the form that I have linked in the chat with more of your questions. Thank you so much for joining us today, and have a great evening. Goodbye.